Welcome to Oncology Revolution, where science meets care to transform the cancer journey. We explore evidence-based strategies to enhance quality of life, promote longevity, and empower patients and professionals to thrive beyond cancer.
I'm pleased to welcome Gilleanne Lenart, Occupational Therapy Clinical Specialist at the Kessler Institute for Rehabilitation in New Jersey. Gilleanne serves as the clinical lead for the Inpatient Cancer Rehabilitation Program, where she works in the development and delivery of evidence-based oncology rehabilitation services. She is also a Revital Cancer Rehabilitation Specialist dedicated to improving function, quality of life, and long-term survivorship outcomes for individuals affected by cancer. Gilleanne, welcome to the Oncology Revolution Podcast. It's such a pleasure to have you with us.
Thank you so much for having me, Raquel. This is quite the honor. I'm very excited to talk about occupational therapy and cancer rehab today.
Yeah, me too. And to begin, I would love to hear about your journey. What initially drew you to occupational therapy and to rehabilitation? Because the occupational therapist can work in so many fields.
Yeah.
And how did your interests focused on oncology? So let me know.
Yes. So when I was in college, I had been studying cell biology and neuroscience. I had always been incredibly fascinated with how the mind worked. So I was really exploring a career in mental health. But I also recognized that I wanted a more physical job, right? I wanted to be hands-on with my patients. So I started exploring all of the different healthcare professions. And then I stumbled across occupational therapy one day. I was speaking to somebody and they had talked to me about how, occupational therapists work in a variety of settings. So, people could be healthcare professionals in a mental health setting. They can be hand therapists, pediatric specialists, right, as you are. And I was just thinking about what I wanted to do in my life. And I said, I feel like this is a really good opportunity to kind of experience so many different things. So I explored going to occupational therapy school. And then that's when I learned what rehabilitation was in terms of adult rehabilitation. So I went into OT school thinking I would either be in mental health, specifically addiction counseling. I found that to be an area of interest of mine. And then on the other end of the spectrum, hand therapy. So those were the two areas of practice that I was really interested in initially when I went to OT school. And then when we started our adult rehab seminars and things like that, I said, oh, this is so fascinating. A career where I can combine both the physical aspect and the mental aspect and look at the person holistically, right? I thought that was really fascinating. And then learning about how we look at the person's environment and how all of those things influence one another. I felt like that would be just an area that I could really, hone my interests and my passions. In terms of how I got interested in cancer rehabilitation, I was just finding as a newer clinician, I was on an orthopedic team. So I was seeing a lot of joint replacements, multi-traumas, hip fractures, things of that nature. And I loved it. I really enjoy working with that population. I still continue to work with that population. However, the individuals who are really resonating with me and the people that I really felt a connection to tended to be the patients that I was seeing, with pathological fractures due to bony mets. So I was meeting a lot of individuals with metastatic prostate cancers, with hip fractures. I was meeting a lot of individuals with lung cancer, with spinal metastases. And, in school, we don't really learn much about cancer rehabilitation. So that was an area of practice that I really wasn't familiar with at all. And I feel like so many, of the clinicians that I work with now also, even a decade later, like 15 years later, still not nearly as much as I would hope, would be focused on in the academic setting. But again, I understand that it's a very specific area of practice. And so when Dr. Stubblefield came to Kessler, he is our medical director for the cancer rehabilitation program, and he proposed creating and implementing an inpatient cancer rehabilitation program, they had asked for some, individuals who were interested in helping the program get started here at Kessler. And so I jumped at the chance just because I wanted to learn more. And I really wanted to, just see how we can make an impact in, the lives of patients with cancer. So, we did tend to see a lot of individuals at varying points in their cancer rehab journeys. Um, and I found that that was very challenging, right? So sometimes we were seeing people when they were initially diagnosed, we were seeing individuals when they were closer to their end of life journey. And, again, the way that you approach evaluation and the treatment of those individuals at very different ends of the life spectrum is incredibly different, right? So again, I wanted to be able to empower myself with the knowledge that I needed to help them and to help their families through whatever phase of their cancer diagnosis that they were in at the moment. So that's how I got to be involved in cancer rehabilitation.
That's amazing. Thank you so much for sharing
Yes.
your story. I see that story here also in Portugal. Well, parts of it where in school we don't learn about oncology, and
Right.
as I'm an occupational therapist myself, I can say it directly that I
Yes.
did not learn anything about oncology. I did have a module on palliative care, and so we touched a little bit of the oncological
Right.
side, but we do not have the context to be able to work in
Yeah.
the oncology field. And the studying about this topic is it's so much needed, but we don't have the opportunity or the place to learn about this. Well, at least here in Portugal, it's very difficult. So that's why the European School of Lifestyle Oncology is doing this all of these
Yes.
courses to help the professionals. But I also see that occupational therapists they come to oncology settings by chance. They did not even know that it was possible to
No,
work in the oncology field, right? Is that
exactly.
something that
Yes.
happens there as well?
Yes, very much so. Yeah, very little is, known in OT schools. I feel like, I've done some lectures, guest lectures at local universities, and, I feel like that is probably more than most programs get, right? So,
Yeah,
is there
for
a better
sure.
way that I could, yeah, I'm trying to think if there was a better way that I could phrase that.
No, it's fine. It's fine. Don't worry. Do you
Okay.
want to redo the answer?
Um, if I can, yes, I just feel like I could
Of
do it
course.
more
Of
justice
course.
than what.
Of course.
So, yes, I do think that in terms of the education in occupational therapy schools and institutions, there is very minimal knowledge shared there, not from a lack of wanting to, it's just from a lack of a time perspective, right? And just cancer rehab being such a small fraction of it, I just feel like they don't have the leisure of being able to fill so much of their academic portion with just cancer rehabilitation. So it's really up to the clinician to seek out the knowledge, right? And there really isn't as much available, especially in just the markets at this point in time. I feel like so much of the education is more a physical therapy based, you know, uh, a physical therapy based perspective. So I do feel like we need more occupational therapists to get involved in cancer rehab.
For sure. And to be able to speak up and be available to do this because as
Yes.
well, at least here in Portugal, occupational therapist works so many hours. So some of them
Yes.
are too tired to to have the availability to do a podcast or to come and do give a lecture or give a
Yes.
presentation on a
Exactly.
conference.
It's so true.
Um,
So I know I treat full time. So I am a full time treating clinician, and being the lead of this clinical program, it really just comes from a place of passion about the patient population, and it's just, yeah, people are always asking me, they're like, how do you do this all? And I say, it's because I love it. I feel like there's such a need. We need more advocacy for this patient population, especially in inpatient rehabilitation, right? It's so much of cancer rehab is in the outpatient setting. So it's so unique to have an inpatient program.
Okay, let's speak more about the program per
Yes.
se. So can you tell us about your role and the program itself at the Kessler Institute for Rehabilitation? I'm very curious to learn more about it.
Yes. So again, our program started about a decade ago, just because we had recognized that we had been treating this patient population. But when Dr. Stubblefield came, right, and we wanted to make it a formal program, we just wanted to establish best practices, right? We wanted to make sure that we were treating these patients from that holistic interdisciplinary view. We wanted to make sure that the entire team was on board, that we all had the necessary education to effectively treat this patient population, just because we know that there are so many complications and the level of acuity in this patient population can be so high. So that's really where we focused our efforts in the beginning, was just that interdisciplinary education, that interdisciplinary communication, just to ensure that we all had a really good understanding of the patient's cancer diagnosis, that we had a good understanding of, how their oncologic prognosis could influence functional outcomes, right? So unfortunately, in the research and even just in real everyday life, we're seeing it, right? These patients are at a higher risk of acute care transfer. They're at increased risk of early mortality. We're seeing so many patients with really advanced cancers, and we know that the risks of infection, just frailty, just so many different areas of their quality of life can be impacted by this cancer. And so we just really wanted to make sure that we were doing our best to look at the evidence and to really implement a plan that could address them holistically. And just to support not only the family, but the caregivers as well, right? Because so many times the cancer doesn't just impact the patient, it impacts the entire family unit. So we wanted to make sure that we had processes in place and education in place and resources that could not just support the survivor, but also, the family and the caregiver.
That's fascinating. And congratulations to all the work you have been doing and
Thank
to the
you.
Institute as well. And
Thank you.
when, of course, and when we talk about oncology rehabilitation, we are really thinking about helping people and their families regain all of the independence they once had, and hopefully they will be able to, and their function, their participation in daily life. So, which brings us naturally to the role of the occupational therapist. And
Yes.
that's something that I learned when I was in the beginning of school, that occupational therapists are the professionals who are going to help you be independent. And as well, of course, as you know, I'm working in pediatrics, so it is very different in the setting and in the context. So I would love to hear from your perspective what is the role of the occupational therapist? What is the role of the occupational therapy in helping individuals regain independence in their daily lives during and after cancer, so that our listeners as well will know what we are doing.
Yes. So when I like to describe occupational therapy, I really like to describe us as the ultimate problem solvers for everyday living, right? So that's really how I describe it to everybody, because people are like, "Oh, you work on fine motor control." I'm like, "Not just that, right?" And a lot of the time, especially in inpatient rehab, people are really focused on the upper body, and I say, well, not just the upper body, right? We're really looking at the entire individual, right? And just how we can maximize somebody's potential to get back to meaningful activity, right? So I think at the crux of it, it's our ability to tease out what's meaningful to them and to really find out the activities, the tasks, the roles that they want to return to, and then understanding where they are in terms of their cancer diagnosis to know what is feasible and what's realistic. And so I think that's one of the biggest challenges, especially in inpatient cancer rehabilitation. It's people are coming at such different phases in terms of their abilities, and in terms of their disease process. So sometimes what their goals are might not align with what we know. are realistically achievable in the amount of time and at the phase of their cancer diagnosis that they're currently in, right? So it's about helping them, you know, increasing that insight, helping to build that awareness, but also helping them build the skills that they can eventually return to doing all the things that are meaningful to them. So whether it be going back grocery shopping in the community, whether it be picking up their grandchild again, right after um, any sort of setback in terms of their treatment. So that's a lot of what we see is we see individuals who've had adverse outcomes to their treatment. So it's just helping them get back to where they were before, the cancer treatment really just, you know, turn their world upside down, right? But really that's what it is. It's just the ultimate problem solver, I think, in rehabilitation. That's what occupational therapy is. And what I do love is how we not just look at the person and the support around them, but also the environment. So one of the things that I've always been interested in is home assessment, right? It's just looking at how we can take your home environment and make it work for you in a way that's going to keep you safer, that's going to help you be able to participate in your daily activities and your self-care routines in a way that's going to help you conserve the energy you need, right, to do what you like to do, to minimize any risk for falling, and just again, to promote being as confident in your abilities within your own environment. So that's really what I think occupational therapy is in a nutshell from an inpatient cancer rehab standpoint.
Yeah, I think you described it very, very well. And well, as for me, when in the pediatrics field, we are also the person who actually gets the kids that no one else can work with. So we are the superheroes.
Yes.
So, oh, there's
Yes.
nothing else to do. Let's talk to the occupational therapist. Maybe they will know
Maybe-
a
Exactly.
strategy. Maybe they will know
Yes.
something.
And I
And
just feel
that's
like,
so
again,
curious.
yes, I just feel like the way that we look at a situation, again, we're looking at it so globally. So we're bringing so many different perspectives, right? Because we're looking at it from the psychosocial aspect, we're looking at it from a cognitive aspect, then the physical aspect, and then again the environment, right? So I just feel like we've got eyes and ears everywhere, and that's really what it is that we do, is we're just, yeah.
Yeah, it's this holistic perspective where we put not we're not just looking for the symptoms, but to everything. We're focusing on the motivations, on the person, on the families, on the
Yes.
context. So somehow we can see something else. I don't know, maybe other
Yes.
professionals should experiment
It's our
this
superpower. That's
perspective. Yeah.
it's our OT
And as you said,
superpower. That's it.
yeah, and as you said, that's another aspect of our work that is very important is the home modification. And
Yes.
let me know specifically in the context of oncology, why is this so important? Well, I know, but let's see our
Yeah.
listeners learning with you.
Absolutely. Yeah. So just with the cancer survivors, so many times, right, their mobility might be limited, their energy, right? The cancer related fatigue can be such an impactful side effect of the cancer and its treatment. And so an individual might not be able to access their environment in the way that they were prior to their cancer diagnosis and prior to their cancer treatment. So it's really about, again, taking a look at the areas that they need to access, that they want to be able to access, and trying to figure out if there are ways to make it, to modify it in a way that's going to help them conserve that energy, that's going to keep them safer, that's going to help keep them in their environment. Because again, when somebody is home, right, we know that people heal better there. We know that people thrive in environments that are, comfortable to them and that are familiar to them. Um, and so in terms of, different home modifications and things like that, it can be as simple as reorganizing the furniture in a way that's going to promote a safer functional transfer. Making sure that a walker is going to fit into the bathroom, taking a look at doorway widths, taking a look at the height of the different seating surfaces that they're going to be, accessing around their home. Um, but we have the unique availability here at my facility where we can do live home assessments. So I am a certified aging in place specialist as well. And so I get to go on some live home assessments where we're able to take the patient with us. I have a van. Well, I don't have a van. We have a van that I get to drive, and we take the patient to their home and we see how they interact with their own environment, right? To see if the things that we've practiced in the inpatient setting is going to translate to home, right? Because sometimes it won't. And so we need to go back to the drawing board. And again, that ultimate problem solver is, okay, we thought this would work. Now we've taken you home and we see that it's not going to work. What can we do next, right? And so we're really lucky in the sense here that there are other providers, there are home modification companies that we can partner with. Um, construction specialists that can tell us what's feasible, what's not feasible. But really, we're just dreaming up the most ideal home environment, the most ideal setup for the patient to thrive. And again, we're just in a really unique position where we can actually do that in real time.
Yeah, for sure. And those kinds of practical interventions are often underestimated, and they can make such a
Yes,
difference and
such a
changing the
difference.
the independence of the people and the family as well. Um,
Yes,
yeah, and
absolutely. I
as you were
know.
saying, that another challenge that often interferes with the daily activities is enduring cancer treatment, and even after the treatment is fatigue. So
Yes,
this need to conserve energy, and which many people describe as one of the most debilitating symptoms they experience
yes,
during this journey, and it's extremely common. So
it's
let's
very
address
common.
this topic. How is cancer-related fatigue different from typical tiredness?
Yes. So I always like to preface it by saying fatigue, right? What do we think of fatigue? You do a lot, you get tired, very activity dependent, right? So you rest, you recover, you feel better, and then you can go on about your day, right? So cancer-related fatigue is different in the sense that it's pervasive. You can do nothing and still feel exhausted, right? Even just picking your head up off of the pillow is just something that seems daunting of a task, right? You can rest as much as you can, and it doesn't alleviate that feeling of tiredness and weariness. And so that's how I like to describe it to my patients. And so many times, even my cancer survivors who've had, the cancer for years, for decades, they're not familiar with these terms, right? And it's always shocking to me. And it's honestly also upsetting to me that this might be the first time that they're hearing it, even if they've had cancer for 10, 15 years, right? And so I feel very passionately about bringing it up in this setting just because, again, it impacts their ability to participate in the therapies so often, right? So the more that we can address it from the beginning and implement the strategies to get them, participating to their fullest extent during their inpatient rehab stay, and then also empowering them with the strategies to take with them once they leave, right? So again, just the cancer-related fatigue, we see it very often, yeah, in this population.
Yeah, and many people expect the fatigue to just resolve with rest as normal tiredness or
Yes,
fatigue, but
exactly.
it's very different. So there is different mechanisms, and it's more complex in the context of
Yes,
oncology. So what are
exactly.
these mechanisms? What are some of the underlying mechanisms contributing to fatigue during cancer treatment?
So it could be the cancer itself, right? We know that cancer is a very inflammatory process. So think of the cytokines that our body's creating, right? So that's one part of it. Then just what's happening at a cellular level, right? Our body's demanding so much more to combat the disease. So think also too in terms of the type of cancer. So some more of the hematologic cancers can have a greater impact. Just because, again, in terms of blood production, blood cells, anemia, right? It's going to have a huge impact on the fatigue. And then the cancer treatment itself. So certain treatments tend to have more of an impact on the cancer-related fatigue. So radiation tends to be, a really big culprit. Not just in acute fatigue, but in also, long-lasting chronic late-term effects of the treatment. So unfortunately, if at any point in their survivorship, right, it, the fatigue might not impact them at one phase, but it can impact them at a later time, right? So I think having them understand that is a really important thing as well. But then also to medications, if they're on pain medication, if they're on, you know, nerve pain medication, those can have a large impact as well on the fatigue. The mental aspect, so the emotional distress, the worry over financial burden, that often can have an impact on the cancer-related fatigue as well. And then lack of sleep, lack of good nutrition, lack of the body's ability to absorb the nutrition, right? There are so many different factors that are impacting, you know, tiredness and the fatigue in this population.
Yeah, for sure. It's multifactorial as you said.
Yes.
And but let's focus then on rehabilitation and its benefits in the fatigue. So what are some strategies that can help manage or reduce these fatigue symptoms?
So, in the research, some of the most supported intervention is physical activity, right? Which is so antithetical. I feel like when you think you're like, I'm tired, I don't want to move, it's sometimes like the last thing that these individuals want to do. But there's so much research supporting the importance of activity, not just cardiovascular exercise, but also resistance training. So, exploring ways to get them moving in a way that they enjoy and in a way that meets them where they're at, right? So many times I'll have patients tell me, oh, I don't like to exercise. And I'm like, okay, well, what do you like to do? Some individuals love to dance, right? So trying to incorporate some of that into our treatment sessions. Individuals who are into yoga, right? We've done a lot in terms of exploring the seated yoga, like seated Tai Chi, things like that, that help to incorporate the mind and the body, right? A lot of the mindfulness-based interventions as well. So, like meditation, we incorporate a lot in our practices. The pursed lip breathing, right? That's so helpful with regards to managing the cancer-related fatigue, but also educating on energy conservation, right? So, looking at activity modification, looking at how we can plan and restructure their day just to, really capitalize on when the energy is at its peak, and then helping educate them and know when to kind of scale back when it's not going to be, optimal to be, going into the shower and doing more dynamic activities. Like if your energy is really bad, maybe not going into the kitchen to prepare a full meal at that time, right? So it's just really helping them kind of structure their days to again meet them where they're at.
Yeah, for sure. And something that you said that was, okay, so what do you like to do? I think that's very much a perspective of an occupational therapist, is that let's
Yes,
focus on your motivation. And I will personalize everything as soon as I know what you like.
exactly,
And yeah,
exactly.
I think it comes our superpower from there, from the people's
Absolutely.
motivations.
Yes,
And
exactly.
personalizing everything. So as treatments improve, more people are living longer and after cancer, and which makes the topic of survivorship very important and long-term quality of
Yes.
life increasingly important. Main focus at the Congress that we are organizing for this year in May in Portugal. Next year is going to be an international edition. I hope to see you there and our
Yes.
listeners as well. It's the Onco Summit, and in this year we are having another room, so a smaller conference in the Congress that is called the Onco Active. It's completely focused in rehabilitation and exercise. So we're very excited for this. And the topic of survivorship and long-term quality of life, it's so important. So we are focusing on this, and I would love to talk with you about this. Um, and to see what do you think are one of the most common long-term functional challenges that cancer survivors experience?
Right. So just with the cancer survivor, right, I feel like the recovery is not linear in terms of trajectory, right? There are going to be so many fluctuations in their status, right? And so I think the most important thing is educating them that even though you might not be experiencing these symptoms currently, there is a possibility in the future that you might, right? And so I think empowering them with the knowledge and then what resources are available in order to obtain the help that they need in the event that they require that additional support. I think that's the most important thing with the cancer survivors. So we're very fortunate in the sense that, we do have a lovely cancer rehab continuum here. So we have the inpatient program, but we also have our outpatient cancer program as well. So the Revital Cancer Rehabilitation Program. And so I think it's so important for us to make sure that our patients are continuing the cancer rehab journey, just because, again, the risk of frailty, the risk of falling just because of a peripheral neuropathy, the risk of just deconditioning is so high in this population. So it's just educating them regarding the importance of continued therapies, and just continued activity, right, is really crucial.
Yeah, for sure. And many people think, even not just the patients, but families and friends and employers, they think that as soon as treatment ends, then everything goes back
That
to normal.
100%. And I think that's a huge part of it too, right? Is not just educating the patient, but educating the support system around them. Because so many times it's like, oh, they don't want to get up. The family is like, how come they're always lying down? And I'm like, it's not a matter of them wanting, they want to move, right? It's just unfortunately the cancer and the treatment are not allowing them at this moment in time, right? So it's just helping to increase that understanding. And again, figuring out ways that they can support their loved one, right? So, and I
For
think
sure.
that's, yeah,
Yeah, for sure. And in many ways, rehabilitation helps so much. Not just the patient, but even this part of the reconnect with people and with the society and facilitating the context. So it's a very important role. And I would love to speak with you about the interdisciplinary team. So just not just the occupational therapist, but the importance of all connecting and speaking about the intervention and the goals of the intervention. So I would love to learn from you what do you think healthcare professionals should better understand and about supporting survivorship beyond the end of treatment and hearing the team perspective.
yes. So again, in addressing these individuals and treating them in a holistic way, we need that interdisciplinary team, right? We can make individually small improvements in our bucket of practice, right? But when we come together as a team, again, I just feel like it elevates what we're able to offer the patient. It just allows us to make sure that we're working to the best of our abilities, right? So, and just working cohesively as a team to make sure that we're all on the same page, that we all have a good understanding of where they are in terms of their cancer journey. And then again, implementing the interventions that we know are going to help. So I feel like, again, that communication between physiatry, between nursing, between therapy, psychology, right? We have a really robust nutrition program here as well. So our dietitians really play a huge role in making sure that our patients are getting the nutrition that they need to participate in the therapy. But also too, having input from like business development, right? And having our like prospective payment system coordinators, right? It's just everyone needs to be on the same page. And I think that's the most important thing is just we need to make sure that everybody has the same goals for these patients, and that we're providing the same messaging. And I think that's the most important thing with the interdisciplinary team.
Yeah, for sure. Like cancer affects so many different dimensions, so it's so important to have a well-structured team with all of the team members, the professions working together and speaking, interacting. So it's so important, and it's great to see that there are programs out there who have all of this. Because, well, maybe you have to come to Portugal and implement something like that here, because
It's
we do so much need it. We have some programs, some small programs, and even it is growing. I cannot say that it's not growing and people are not aware of it, because with the current um, outcomes and the knowledge that is out there, of course, here in Portugal as well is growing, and we have more, but we are still a small country, so we need more, and we need more impact from countries that are already having these programs implemented. So it's so nice to listen from someone who has this perspective
Thank you.
and this life. um,
Yeah. And I think the most important thing, right, is it's really finding the people who have an interest in cancer rehabilitation and fostering that interest, right? So that's really been, I think, the turning point for this program is really finding the individuals who have a strong passion for this client population. And then again, it's that constant communication, just because we find, right, again, we are a smaller bucket in a very large rehab world, right? So again, just making sure that we're making our voices heard and that we're advocating for our patients, just because again, their needs are very unique, and they do tend to be some of our more complex cases. So just the more education we can provide to the team, the more vigilant we are in terms of treating this patient population, the better the outcomes for everybody.
yeah, for sure. So, as we are getting to the end of our episode, and this has been a great conversation, and I have been loving the time that I've been speaking with you, Gillian. I would love to hear one last message from you. So, something that you would want our listeners to take home and think about. What's your last message for us?
So I think my biggest message is that rehabilitation is appropriate for any cancer survivor at any point in their journey. And I think helping them understand that and letting them know that we are there can make such an impact on their quality of life and on what, they're able to accomplish, in terms of their goals. So many of the survivors that I've met had no idea that cancer rehab had existed. And I just feel like the more people know that we're out there, the more people we can help. And that's really the most important thing. I think just advocating for our patients is going to be so important going forward for the continued growth of cancer rehab, internationally. And I'm just excited to see, what we continue to do going forward.
Yeah, thank you. Thank you so much. It was an amazing moment being here, sharing your experience with us. This conversation highlights how important rehabilitation is in helping people and families and society to maintain the independence and the participation and long-term survivorship. So thank you to you, Gillian. Thank you to everyone who was here listening to us in the Oncology Revolution podcast. And if you enjoyed the conversation, make sure to follow the podcast and to see what else we have been working on. Thank you again, Gillian, for this moment.
Yes. Thank you so much for having me. I really enjoyed it. Thank you.